Well, good evening, everyone. Welcome to our parenting series. I'm Anna Kennedy with Touchstone Foundation, and I'm pleased to welcome everyone this evening to A Parent's Guide to Raising Resilient Youth with Touchstone Foundation and Dr. Tom Foley. So, welcome, Dr. Foley, and I'll turn it over to you, and we will be discussing uh, early support and proactive care this evening for kids of all ages. And really, this guide is meant to support parents and families and caregivers in supporting and raising resilient youth of all ages. So this is all about helping kids before things escalate and what can we do as parents to help children thrive and become mentally well and healthy, as well as parents too. So I'm going to turn it over to Dr. Tom Foley. Welcome.
Okay, thank you, Anna. Thank you all for being here. Okay, so again, my name's Tom Foley. I am a child psychiatrist who practices psychiatry, working with kids and families in central Pennsylvania for about the past 15, 16 years. So before we get started tonight, just wanted to, as we do at the beginning of these sessions, take a brief moment to remind everybody about what the series is all about. As Anna had said, the Touchstone Parenting Series, A Parent's Guide to Raising Resilient Youth, is designed to be a clear, hopeful, and practical resource for parents who are navigating today's increasingly complex world. As we all know, there's a ton of information out there, and unfortunately, often conflicting advice about parenting and children's mental health. So the goal of this series is to help cut through that noise, offer guidance that's grounded in both research and real life experience in a way that feels usable and realistic for families. Through the series, we'll come back to a few core ideas. So supporting family resilience and helping children adapt to challenges, strengthening emotional connection and co-regulation, building strong, healthy relationships within the family, and encouraging a growth mindset and learning through difficulty. At its core, the series is about helping parents feel more confident, less overwhelmed, and better equipped to support their children, not perfectly, but in ways that are meaningful and sustainable over time. We aim to keep the tone here grounded, compassionate, and practical because parenting is hard and you're not meant to do it alone. Okay, so tonight we're going to talk about something that I believe is incredibly important in children's mental health and often, unfortunately, overlooked, and that's the idea of early support and proactive care. So most kids do not need crisis intervention. And do you want me to fast forward the slides there?
It looks good.
Oh, okay.
Yep.
Got it.
No, it's okay.
Okay. Um, okay, so again, most kids don't need crisis intervention, but many families do need more clarity, more confidence, and more guidance in those early moments before things escalate. A lot of parents today feel caught between two fears. One fear is, what if I'm missing something important? And the other is, what if I overreact and turn a normal struggle into a bigger problem? That tension is exhausting for parents because modern parenting often feels like you're being told to monitor every emotion, analyze every behavior, and constantly ask, is this normal or is this a problem? And tonight, I really want to help reduce that fear and uncertainty because the goal is not to react to every struggle like an emergency. And the goal is also not to ignore things until they become severe. The goal is to become better at noticing early signals, staying calm, and then responding intentionally. Because by the time things reach a crisis point, we've often missed dozens of smaller opportunities to guide, support, teach coping skills, and to build resilience in a calmer, more manageable moment. So let's start with a quick scenario. Your child comes home from school, drops their backpack, and says, I don't want to go back tomorrow. That's it. Just that statement. No big explanation, no meltdown, no dramatic scene, just that one sentence. I don't want to go back tomorrow. Now, most of us naturally go to one or two directions. One reaction is they're just tired, it's probably nothing. The other reaction is something's wrong. Are they anxious? Are they being bullied? Do we need to fix this immediately? But there's actually a third option, and that's the option we're focusing on tonight, where we pause, notice, stay curious, respond just enough, not ignoring it, not panicking about it, but treating it as an early signal. Because that moment right there, before things escalate, is the moment where the biggest opportunity exists. Not when it falls apart, but when something small first starts to shift. One of the biggest shifts I hope parents walk away with tonight is that moving from a reactive mindset to a proactive mindset. So a reactive model might say, we respond when things become severe. A proactive model says, we pay attention earlier. And those are very different approaches. Reactive parenting often looks like waiting until things become overwhelming, responding emotionally, trying to stop the immediate distress, and then focusing on short-term relief. On the other hand, proactive parenting is very different. It focuses on noticing patterns early, staying calm, building skills gradually, and helping kids learn how to handle manageable levels of stress. And this is important. We're not trying to prevent all struggle. That is neither possible nor healthy. What we're actually trying to do is prevent unnecessary escalation. Because if we only respond at the point of crisis, we miss most of the opportunity to help. One challenge is that early signs of stress are often subtle. And because they're subtle, parents either dismiss them or catastrophize them. But many early signs of emotional strain look very ordinary at first. Sometimes it's irritability, a child who is suddenly more short-tempered. Sometimes it's avoidance, not wanting to go to practice, dragging their feet with school, pulling away socially. Sometimes it's a change in sleep. And other times it's just shutting down. You'll hear phrases like, I don't care, or whatever, or leave me alone. Sometimes it's lower frustration tolerance. Things that normally wouldn't upset them suddenly feel overwhelming. And here's the important reframe. These are not necessarily signs that something is seriously wrong, but they are signals. And so they're signals to pay attention to. And this is where I think we've lost some balance culturally. Not every emotional signal requires major intervention. Kids are supposed to struggle sometimes. Kids are supposed to feel disappointed, nervous, frustrated, embarrassed, discouraged. Those emotions are part of development and they're normal. But emotional signals do deserve awareness. Again, not panic, not avoidance, but rather awareness. One of the most important concepts I want parents to understand tonight is what I call the window of opportunity. So there's a period where kids are struggling enough to benefit from support, but still regulated enough to learn skills. So we're going to walk through a couple different, what we'll call zones, okay? So let's call it the green zone, kids are calm, regulated, and flexible. In the yellow zone, stress is increasing. They're frustrated. You might start to see some signs of avoidance. Emotions get louder. This is the sweet spot, or it can be very often. This is where the learning has the potential to happen for most kids. Then there's the red zone, the overwhelmed zone. Everyone knows what this looks like, right? All caregivers, parents, anyone that's seen, especially young kids, right? So the kids are overwhelmed, meltdowns, panic, explosive behavior, possibly even complete shutdown. Looks like they're paralyzed and just completely shut down. And here's what parents need to remember. Skills are not built in the red zone. They're built in the yellow zone. When kids are deeply overwhelmed, the brain shifts into survival mode. Reasoning becomes harder. Flexibility decreases. Problem solving narrows. That's why waiting until everything becomes severe is so difficult. Because once kids are in crisis, our options become narrower. But earlier support, that's where we can still teach, coach, guide, and practice. And before we move on to a grounding exercise, if we want to think about this like from either or biologic perspective, really what happens is, and a lot of people have heard of these terms, there's the frontal cortex, the frontal part of the brain, which is the thinking part of the brain. And then there's the temporal cortex, which is more of the emotional part. Kids that are younger, their frontal cortex has not yet developed, but their temporal cortex, that emotional part, comes online much faster. And even in adults, when everything's online and working really well, if we are fired up, worked up, angry, whatever that emotion is, if the temporal cortex is the thing that is on fire, the part of the brain that is most active, everyone knows this, which is what led to, I believe, the Thomas Jefferson quote of, when you're angry, count to 10, when you're furious, count to 100. The idea of letting that emotional part of the brain settle down so that the frontal cortex can come back online. What we were just describing with the kids is that before that emotional part of the brain becomes on fire, but when it's starting to get a little bit revved up, that logical part of the brain is still online and still possible to engage. And there's the opportunity. That's the opportunity to try to help the kids to identify what's going on, communicate, what the issues might be, and then really the learning. So whether these or whatever the case may be. Okay, so before we go on, I think, Anna, we have a grounding exercise.
Yeah, thanks, Tom. So um, I wanted to introduce a simple technique that parents can practice on your own and with your children. And the first step in this is to try to stay calm for ourselves in order to stay calm with our kids. So co-regulation starts with regulating our own emotions and mindset first. So a simple technique is box breathing. This can also be called four square breathing, but it really just helps to lower our heart rate. So as parents, if we start to see our child get, you know, worked up for whatever reason, what Dr. Foley was just describing, um, we can match that child's emotion really easily. But what is more helpful is to try to stay calm. So we'll just practice a few rounds of box breathing and try to pay attention to your heart rate and see if it slows down a little bit. You can even just feel your heart rate. So we're going to start with an exhale and then inhale. You can count to 4 if that's helpful, and then hold, and then exhale, and then hold, and inhale, and then hold, and exhale. It usually takes about 4 or 5 rounds to really start to notice the heart rate decreasing. But once your own heart rate has started to decrease or come back to like a normal rhythm, that's regulation. And then I think we as adults, as parents, can be in a space of calm and not panic. to be better equipped to help our children when they're starting to feel a little bit worked up. And I'll come back in a few minutes later and talk a little bit more about what we can do to co-regulate with our children. So, Tom, I'll turn it back over to you.
Okay, thank you, Anna. It is so interesting that the concept of the breathing, and this box breathing is being taught in schools. There's a reason why the military uses it for soldiers. I mean, it is literally a physiologic hack to help somebody to slow down and physiologically to turn off their central nervous system or bring it down a little bit. And to Anna's point, and it goes directly into what we're talking about now, this idea that as a parent, we can calm ourselves down so we can be in this position to really help the kids in these moments. We can then teach the kids the same thing. And so there's just so many layers to how important this is. All right. So back to kind of this scenario we just talked about, right? So these different zones trying to kind of capture the children before they're in the red zone and before the temporal cortex is on fire, and they're kind of so dysregulated that they're not able to think clearly. So I think that one of the probably the hardest parenting decision of all, with the context of everything we're going to talk about tonight, is trying to decide, when do I step in? When do I step back? Because both extremes can create problems. If we step in too little, kids can feel unsupported. If we jump in too much or too quickly or too forcefully, the kids never build confidence in handling difficulty. So let's talk about when to step in. There are times when children truly need more support. You step in more when your child is getting to that point of being overwhelmed or unable to recover independently, or if they're already to the point of escalation where they are not able to kind of manage the situation on their own. You also step in when the pattern seems to be worsening, or if over time we see that their kind of day-to-day functioning is declining, so they're not going to school, their social interactions are off, they're not able to kind of participate in sports any longer, if sleep is deteriorating, or if avoidance keeps increasing, then again, it gets in the way of day-to-day life. The other time you might consider stepping in is when emotional distress is starting to interfere again with kind of the day-to-day, their lifestyle, their regular life routine. Sometimes parents wait, on the flip side, sometimes parents wait too long because they're afraid of overreacting. But if a child is repeatedly stuck or is clearly deteriorating, that's important information. So let's talk about when to step back. There's also moments when stepping back is the healthier choice. A child may be frustrated, but still be capable. They may lack confidence, but not capacity. Sometimes the discomfort itself is a growth opportunity. A child being nervous presentation, frustrated with homework, or even disappointed socially does not automatically mean we should remove the challenge. Support does not mean removing the struggle. Support means helping them to handle it, and maybe ideally even learning from the experience. Sometimes helping them handle it means saying something like, "I believe you can do hard things." Parents often ask, okay, but what does proactive support actually look like? Usually it's smaller and calmer than most people expect. So for example, we'll go through a couple different examples here. So number one would be noticing and naming. Sometimes the most powerful thing you can do is to simply notice what's going on. So comments such as, "I've noticed you seem more frustrated lately," or "I've noticed school has felt harder this week." Those types of statements, they communicate, "I see you," without creating panic. Number two, again, back to co-regulation, remain calm. So your nervous system becomes a cue for your child's nervous system. If we respond to every struggle with urgency, kids begin to interpret distress itself as danger. On the other side, calmness communicates this is manageable. Third possibility is creating small moments of connection. So kids often open up indirectly. Car rides, bedtimes, walking the dog, having a catch. Side-by-side moments that are often easier than intense face-to-face conversations. Another is coaching without immediately fixing. One of the hardest things for loving parents is resisting the urge to solve everything, and especially solving everything right away. But confidence grows when kids participate in solving problems. For example, instead of, here's what you should do, you would maybe try something like, what do you think might help here? That small shift builds ownership. And then lastly, building what we could call micro skills. So resilience is not one giant skill. It's hundreds of small moments. Some examples would be pausing before reacting, recovering from disappointment, tolerating uncertainty, trying again after failure, managing frustration without escaping it immediately. These moments may look small, but they're the foundation of emotional strength. Okay, and I think you had one more
Yeah,
exercise.
thanks. Thanks, Dr. Foley. So, just to elaborate a little bit about on co-regulation, I thought it might be helpful to just walk through a simple scenario of putting this into practice as a parent. So after we've done the breathing technique, whether it's box breathing, square breathing, something like that, I think that the next step in co-regulation with our children is to first get on their level. So that might mean sitting next to them or kneeling down beside them, but not towering over them. It is really helpful to be on the child's level. And then at that point, really the most important, I think, in this is, and I think Dr. Foley, you just briefly talked about this, but naming the emotion. So, it could just be a moment of, it looks like you're feeling a little upset right now, or I'm sensing that you may be a little bit, annoyed or overwhelmed. Um, Oftentimes I think children especially can have a challenge in naming their emotions. So sometimes as parents it can be really helpful for us to help to name their emotions or suggest, or maybe that is more of a question, like, are you feeling a little bit you know scared right now, or is this uncomfortable for you? um, and then just staying calm and asking if the child would like a hug, or, some other form of comfort. Um, it could be a hug, it could be, um, maybe they need a little bit of time for themselves. And that is, again, just asking that question and giving the child that choice, and that ownership can be really, really empowering. And so the feelings wheel can be really helpful. This is sort of the inside out, main feelings in the center, the sort of larger categories, and then going out from there. Each one has a little bit more detail of nuance of individual feelings. But again, the breathing can help those emotions to um, change and dissipate even more quickly. So as we're doing this, asking the child again, how they're feeling after taking some deep belly breaths or box breathing can be really, really helpful. I'll turn it back over to you, Dr. Foley.
All right. Thank you again, Anna. Okay. So now I'd like to talk briefly about some very understandable, we could call them parenting traps. Okay, so the first one would be maybe waiting too long. So sometimes parents minimize concerns because they're a little bit worried that they may be overreacting. And unfortunately, that can occasionally delay helpful support. The second one is stepping in too fast. And we kind of talked about this a few minutes ago. So sometimes we rescue too quickly because we hate seeing our kids uncomfortable. I think this is really common, especially in very thoughtful, tuned in parents. But removing every discomfort can unintentionally communicate, you can't handle this. And it's a nuance that is hard to see in the moment because you're doing what you feel like is the right thing and trying to help. But in reality, we're kind of undermining the kids in that way. Um, so again, like we talked about, so if they're in distress, if they're struggling, just kind of taking a moment, pausing, checking in with yourself, and not trying to jump in right away and to kind of rescue them in that situation. Another is similar, I think, which is interpreting all distress as danger. So not every hard emotion means something is wrong. Sometimes it means your child is growing. Okay, so again, what you communicate, your reaction is very powerful in the way that the child growing up will respond to stressors or situations that may be challenging or difficult. Another would be only addressing the behavior. So a child who is irritable, withdrawn, or maybe, having some behavioral issues, you might call it oppositional, may actually just be overwhelmed underneath. And I think that this is a really important one whenever we think about, especially kids, but also for teens, that the behavior on the surface, especially because a lot of us, I think, were raised to, in a way that, certain behaviors deserve a certain response or consequence. But if we kind of keep that in check a little bit and we think about the reality, which is that every behavior is really indicating something underneath, right? And what are we missing? What is it telling us about possibly what's going on emotionally for that person, right? And then there's that opportunity. But we also don't want to be overreactive and panic and jump right in. So again, it's this delicate balancing act, which again, the second theme of this entire talk should really be co-regulation because we're really talking about how what the kids are experiencing is may or may not be triggering us and then our response to that, right? If we can keep ourselves level-headed and in a good place, we could potentially be in a place to try to help the kids to learn from those experiences. Um, so that ties into the last point, which is going straight to high-level interventions, right? So sometimes families jump immediately to intense solutions before foundational supports are strengthened. So thinking about the basics, right? So sleep, routines, connection, stress management, problem solving, and coping skills. If we had to like condense things, one of the things that I would say I see in the office for the kids that I work with, no matter what the situation is sleep and routines are like the first things that I want to talk about. Because if those are off, right? And when we talk about routines, it could be anything from healthy pro-social activities like, again, connection or just being involved in activities, whether it's with family, friends, community, to eating patterns, staying hydrated, being physically active. The sleep and the routines are so key and foundational to the kids' overall health, but absolutely from a mental health perspective. So overall, I think many parents today tend to do one of two things. Again, either under respond or tend to over respond. The goal is to respond just enough. So I also want to be really clear. Again, I am a psychiatrist, and even though this is an educational talk and talking about parenting, it is important that we make sure that we talk about that seeking help early can be incredibly valuable. So support is not a sign of failure, and it's not automatically a sign something is deeply wrong. So consider professional support when, for example, symptoms persist for several weeks at a time. As we talked about earlier, if functioning seems to be declining, so the, the young person is not able to engage the way that they were before in their daily activities, whether it's socially or academically or even making it to school. If we notice that avoidance is increasing, again, to the point of being impairing to some degree, if mood, anxiety, or behavior is clearly interfering with that daily life, or if the family just feels stuck because of, they've been racking their heads around what might be going on, trying to figure out how to help the situation because there's some issue, and round, no solutions, no, just really feeling confused and overwhelmed. Often earlier support prevents more severe escalation later. And that is really important, especially with what a lot of people are calling the mental health epidemic in kids in our country over the recent past, and then looking at the studies that suggest that a huge percentage of kids are struggling emotionally, and it's not being picked up early enough. So the earlier we can kind of recognize kids that are struggling and getting them help, um, it can certainly prevent more problematic emotional or behavioral difficulties that may evolve later on. And just a real quick comment about this, because one of the questions may be, well, who do I go to? How do I do this? Honestly, the best thing to do first is every child is connected to some type of educational program, and every child is connected to some type of primary care physician. Probably getting input from teachers as to what they're seeing to see, if you're seeing the same problems in both settings, at home and at school. And the person to reach out to first, if you're not sure how to get connected with like a therapist, for example, would maybe just be to follow up with the primary care doctor and say, hey, we're noticing some of these challenges. Can we touch base about this and get further guidance from them as to where to go from there? So when we step back from everything we've talked about, again, the goal is not to raise kids who never struggle. That's impossible. The goal is to raise kids who know how to move through struggle, to raise kids who can tolerate frustration, recover from disappointment, ask for help when needed, and gradually build confidence in their ability to handle hard things. And that process does not usually begin in crisis. It begins much earlier, in small moments where we notice, again, pause, stay calm, stay connected, and then guide your kids just enough. Because again, resilience is not built by avoiding hard things. It's built by learning how to move through them. Okay, so that was the end of my presentation. Um, and then I think we're going to take some questions if we have some.
Sure. So if anybody has a question, you're welcome to put it in the chat or the Q&A, and we can open it up for questions. Um, I could maybe start with a question while we're waiting. I I wonder if kids who may be struggling with a little bit of anxiety, when we start to notice that activation or that feeling of unease or uncertainty with kids, um, if it's helpful to kind of take a step back and remind them of like the last time that they did this similar hard thing, um, and whether sort of taking it out of the immediate moment is helpful, or I don't know. I'm curious for your thoughts on um, that as a strategy. Sometimes it works for me as a parent, and sometimes it doesn't. So.
And to your point, Anna, every kid is so different, right? So I think that a lot of this is just like a lot of aspects of parenting is trial and error, right? And the truth is, especially when I see families in the office, one of the things that I find myself saying so many times, which I totally believe is true, is when I'm talking to a caregiver, Well, actually, when I'm talking to a teenager, I guess they're the first one that I'll say, no one knows you better than you do, right? And when you talk to a caregiver, usually, especially for a child, it's like, no one knows this kiddo as well as you do, right? So when you're trying to think about like what works and what might not work, um, again, that knowing the temperament of the child and what has worked in the past is so powerful because you're not starting from scratch. And to your point, Anna, building upon previous learning opportunities, that's really the name of the game, right? Because this is like life is supposed to be an ongoing learning process for all of us. Well, that starts for a kid when they're very young, right? A part of your question, I think about almost. Let me try to reframe part of your question. You tell me if I'm onto something here. Are you saying that like maybe because it's so overwhelming to think about the emotion in the moment that almost giving them helping them step away from that to think about the past is almost easier to kind of manage in the moment?
Yeah,
Is that kind
sometimes.
of what you're saying?
Yeah.
Yeah, no, I think absolutely true. That's absolutely true. And again, I think it depends on the child, depends on the situation. I think that very often that can be the case. Again, if you think about it from the perspective of what is anxiety, it's an over arousal, right, of the nervous system. And again, we could pull up the feeling wheel. There's 1,000 feelings that all of us struggle with kind of understanding how to describe them, which is why something like that is
Yeah.
so helpful. But anxiety is just a big emotion. And if they're feeling so much anxiety that they're having a hard time in the moment, even sitting with it, then okay, then that's an opportunity for you to recognize that that's where they're at and they can't handle it. So that may be a great technique then to kind of relate it to something else. And at the same time, then how did you overcome that? Oh yeah, you did survive. And oh yeah, you were able to rise above that. And so again, it does several things if they're able to engage in that moment. But again, to your point, kind of pulling them away from what's in their face emotionally, sometimes that can be super helpful.
Yeah,
Yeah.
and it also gives me a good cue of am I intervening too much, or do I need to just let the child sit with it or vent? Sometimes it's just like I don't need help. I just need to like vent the emotions. And I'm like, oh, okay. All right. Then that's helpful. But yeah, thank you.
Yeah, how many times does that happen, right? Where, your gut reaction because we're so busy and then we're overwhelmed ourselves in the moment because they're overwhelmed and you want to put out the fire, right?
Right.
But how many times does it happen where you actually, if you're able to stay calm and then they start to talk, then you start to understand even more about what's really going on. Whereas if you jumped in and cut them off right away, you would have missed the boat, right? So that's one of the real challenges, again, is just kind of taking the time, and maybe the time is not right now because maybe there's not the time. Maybe we were in line at the checkout at the grocery store and that's not the time, right? Maybe it's in the car 5 minutes later or whatever the case may be. But finding the time to try to figure out the behavior that you're seeing or that response, what's really going on. And again, so much easier said than done so often, right? Because it does take time and sometimes the child has to be in the place to be able to be ready to talk about it. Or if we're talking about a younger kiddo, they may not even be able to understand what's going on. And then it's
Right.
even more challenging, right? So a lot of that is developmental in terms of kind of where they're at in their age.
Yeah. But I think, like you said earlier, the routines, the sleep,
Mm.
and the healthy habits are really at the core. Because, I mean, if the child is tired, hungry, none of this is going to be as effective, right?
Yep.
Or too much screen time, like we talked about recently in a previous episode. Um, yeah, those are all cues of like, it's probably not the right time.
Right. Yep.
So,
I agree.
yeah, thanks. I don't see any questions in the chat. So I'm happy to we can move on. We can give it a little bit more time. Yeah, we can talk about our next and maybe final topic in the series. So we are going to be wrapping up in June. So our next webinar will be on actually June 24th. It's also Wednesday at 7 p.m. And we will be talking about the future of youth mental wellness, skills for an uncertain world. So we'll be, I think a lot of the topics that we've been talking about and discussing, we'll have a bit of an opportunity to revisit some of those topics and also talk about, kind of skills and what's next in like what to expect in the future. Dr. Foley, do you want to say anything more about our last topic in June?
Yeah, no, I think you're right. I think it'll tie together a lot of the concepts and ideas and philosophies that we've talked about to this point, and we'll try to keep the core themes that we've had throughout the series. Um, it's the challenge is going to be talking about what the future that we don't know, right?
Right.
And what to expect. And it's a brave new world, and we've all been going through these fun experiences of trying to keep up with technology and AI and what does that all mean for us moving forward? Um, there's a lot of talk about what will it look like for kids today when they're going to college or thinking about a career when AI is in the landscape. What is that going to do for jobs in the future? And nobody knows, and this is creating a huge amount of, anxiety because of the uncertainty, which makes sense. And so I think again, this idea of we as humans and the way our brains are set up, that's not really going to change, right? But there's a lot of other things that are constantly changing around us, and technology is exponentially changing. So the question is, how do we stay mentally well in the face of all of that change? Which again, the concept is not new. It's just going to be an ongoing, always evolving stuff around us that we have to adapt to. And I think a lot of it is going to be, again, staying grounded in certain basic concepts that are tried and tested, and that we know have worked for humans for a long time. And research continues to go on as to what works best. And so that's kind of what we're going to kind of pull all that together for that last session.
Thank you. And in a lot of ways, it seems like, grounding ourselves in what works and whether that's, connection, belonging, um, the basics of of humanity and, what brings us together are all of those, making meaning and um, yeah, spending time together. So that'll be great. Well, thank you. I want to just remind everyone and that we have a survey that will be sent to you in email after this webinar, and we encourage you to share your feedback. I think we'll end a little bit on the early side this evening, but this is great. And again, thank you, Dr. Tom Foley, for joining us this evening. Thank you, everybody, for being here, and we'll look forward to seeing you in June. Thanks again.
Thanks, Anna. Thanks, everybody.